Hi everyone, welcome to our program Doctor, and today my topic is malaria. Malaria is a mosquito-borne infectious disease caused by the parasitic protozoans of the genus Plasmodium. And protozoans are unicellular organisms, and there are four important species of the Plasmodium can infect the humans. These are Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. And majority of the deaths are due to Plasmodium falciparum and Plasmodium vivax infections. And the term malaria comes from the Greek word mala means bad, area means air. And malaria is common in tropical and subtropical regions because of the rainfalls, warm temperature, and stagnant waters can provide an environment ideal for mosquito larvae. Coming to the life cycle of malarial parasite. The malarial parasites pass their life cycle in two hosts, definitive host and intermediate host. The female Anopheles mosquito acts as the definitive host and man acts as the intermediate host. The definition of definitive host is a host in which the parasite attains sexual maturity. That means the sexual development of parasite occurs in mosquito. And intermediate host means a host in which the parasite passes one or more asexual stages. So, asexual development of parasite occurs in man. And for human cycle, sporozoite is the infective form of the malarial parasite. And these sporozoites are present in the salivary glands of the female Anopheles mosquito, and man gets infection by the bite of infected mosquito. And sporozoites are introduced directly into the blood circulation. And human cycle consists of the following stages: pre-erythrocytic schizogony, erythrocytic schizogony, gametogony, and exoerythrocytic schizogony. Coming to the mosquito cycle, sexual development of the parasite occurs in the mosquito. Coming to the signs and symptoms of malaria. The signs and symptoms of malaria typically begins 8 to 25 days following infection. And these include headache, intermittent fever, shivering, joint pains, jaundice, hemolytic anemia, hemoglobin in the urine, retinal damage, and convulsions. And the classical symptom of malaria is febrile paroxysm. In this, there are three stages: cold stage, hot stage, and sweating stage. In cold stage, patient feels intense cold and shivering, and it is followed by hot stage. In this, patient develops high fever, and which is 40 to 40.6 degrees Celsius. And also patient develops severe headache, nausea, and vomiting. And then fever ends with profuse sweating. This is called sweating stage. And this cycle is occurring every 2 days in case of Plasmodium vivax and Plasmodium ovale infections. This is called tertian fever. And it is occurring every 3 days for Plasmodium malariae and Plasmodium falciparum infections. This is called as quartan malaria. And severe malaria is usually caused by the Plasmodium falciparum infection. That's why this is also known as falciparum malaria or pernicious malaria or malignant malaria. And it is a life-threatening complication due to heavy parasitization. And the clinical manifestations in pernicious malaria are cerebral malaria, algid malaria, and septicemic malaria. Cerebral malaria is characterized by hyperpyrexia, coma, and paralysis. And algid malaria is characterized by cold, clammy skin leading to peripheral circulatory failure. And in septicemic malaria, there is a high continuous fever with involvement of various organs. Coming to the black water fever, this is due to Plasmodium falciparum infection characterized by intravascular hemolysis, fever, and hemoglobinuria, that is passage of black colored urine. Coming to the complications of malaria, benign malaria and malignant malaria. Benign malaria is caused by Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae, and malignant malaria is caused by Plasmodium falciparum. And complications due to benign malaria are anemia, splenomegaly, that means enlarged spleen, hepatomegaly, that is enlarged liver, herpes labialis, and also renal complications. And the complications in malignant malaria are cerebral malaria, hyperpyrexia, hypoglycemia, liver damage, dehydration, gastrointestinal symptoms, acute renal failure, severe anemia, collapse, pulmonary edema, and black water fever. And anemia in the malaria infection is due to variety of reasons: destruction of parasitized and non-parasitized RBC, hypersplenism, autoimmune lysis, antimalarial therapy in glucose 6-phosphate dehydrogenase deficiency individuals, increased fragility of RBC, decreased production of RBC from bone marrow suppression, and decreased incorporation of iron into heme. So these are the variety of reasons for the anemia in case of malaria. Malaria in pregnant women is an important cause of stillbirths, infant mortality, and low birth weight. Coming to the classification of malaria. According to World Health Organization, malaria is classified as severe and uncomplicated. It is considered as severe malaria when any of the following criteria are present. Otherwise, it is considered as uncomplicated. And the criteria are decreased consciousness, significant weakness, the person is unable to walk, inability to feed, 2 or more convulsions, low blood pressure, difficulty in breathing, circulatory shock, pulmonary edema, renal failure or hemoglobin in the urine, and a parasite level in the blood greater than 1 lakh per microliter. Coming to the recurrent malaria. Symptoms of malaria recur after varying symptom-free period. Depending upon the cause, the recurrence can be classified either recrudescence, relapse, or reinfection. Recrudescence is when symptoms return after a symptom-free period, and it is caused by parasites surviving in the blood after inadequate or ineffective treatment. This is usually seen in Plasmodium falciparum infection. Relapse is when symptoms reappear after the parasites have been eliminated from the blood but persist as dormant hypnozoites in liver cells. And this is commonly seen in Plasmodium vivax and Plasmodium ovale infections. But there are no relapses in Plasmodium falciparum infection. Reinfection means the parasite that caused past infection was completely eliminated from the body, but a new parasite was introduced. This is called as reinfection. And people may develop some immunity when exposed to frequent infections. Coming to the laboratory diagnosis. Peripheral blood smear is the most important diagnostic procedure in case of the malaria. Thick and thin blood smears are prepared on the same slide or 2 different slides. And blood for the smear should be collected few hours after the height of the febrile paroxysm because the parasites are abundant in this period. And blood is taken by pricking a finger prior to start of anti-malarial therapy. And the malarial parasites may be quickly detected in the thick blood smears, but the species identification is possible with the thin blood smears. And a minimum of 100 microscopic fields should be examined to identify the parasite. and other laboratory tests. These are fluorescent microscopy, quantitative Buffy-Coat test, that is QBC, and this is a new method for the identification of the malarial parasite, and also some rapid diagnostic tests like parasite F test, and also some of the serological tests like ELISA, enzyme linked immunosorbent assay, RIA, radio immune assay, indirect hemagglutination assay, indirect immunofluorescent test, and also polymerase chain reaction. Coming to the treatment. For acute malaria, chloroquine is the treatment of choice, and for the chloroquine resistant strains, mefloquine is the treatment of choice. But mefloquine resistant Plasmodium falciparum have been reported. Artemisinin and its derivatives are the newer anti-malarial drugs. These are used for the mefloquine resistant strains and also multi-drug resistant strains. Coming to the prevention and control. Vector control is by using the effective insect repellents, insecticide treated mosquito nets, and also indoor residual spraying. And biological control by using the anti-larval parasites, and these are the bacteria Bacillus thuringiensis and also larvivorous fish, that is Gambusia. And also malaria can be prevented by using the malarial vaccines, and these vaccines are under trial. And this is some important information about the malaria. I hope you enjoyed this program. Thanks for watching. See you in the next episode with another topic. Till then, take care.